Margaret is a 32 years old lady and she had come to counseling through a referral from her primary care doctor. She was simply stated as generalized anxiety as a reason for the referral. She described herself as sensitive and emotional. She had read up on CBT before coming and was hopeful that the course of therapy would sort her out. Margaret is currently experiencing panic disorder, which is a frequent panic attack that occurs not relating to the specific situation. Panic disorder is a sudden, intense episode of terror, feelings of impending doom. Some of the physical symptoms include labored breathing, heart palpitations, sweating, and chest pain, and other symptoms are intense urge to flee, this depersonalization, or fears of going crazy, losing control, or fears of dying. Panic disorder often is uncued attack, which means it happens unexpectedly. Margaret also may be suffering from agoraphobia. Agoraphobia is part of anxiety disorder, characterized by symptoms of anxiety in situations where the person perceives the environment to be unsafe with no easy way to get away. This includes situations like crowds, stores, malls, or trains. Agoraphobia is not a part of panic attack. The individual fears to avoid these situations because of thoughts that escape might be difficult or help might not be available in this event of developing panic-like symptoms of other incapacitating or embarrassing symptoms. Agoraphobia may be the reason that triggers the panic attack of Margaret. Margaret is showing the symptoms of panic attack whenever she goes out of public or when she goes shopping where there is many people and is an open place. Whenever she gets panic disorder, anxiety hits her heart with fear and urge to escape the situation. Anxiety triggers the fear of fight or flight. 2 years ago, Margaret's mother died of cancer, and this caused great stress in Margaret's life. Since then, Margaret showed vivid symptoms of panic attack in public, and she let it slide as if it's not a big deal. But since then, the symptoms became worse, causing the panic disorder. When Margaret was 5 years old, she saw her mother getting physically abused by her father whenever he came home drunk. As Margaret became older, the abuse moved onto her siblings as well. This traumatic experience was forgotten behind her unconscious mind when her parents were separated, but it had huge impact on Margaret. And the unconsciousness of traumatic experience finally came on surface when her beloved mother passed away, which she loved dearly. This kind of unconsciousness, mind, and memories of past experience triggered the panic and anxiety to Margaret, which led to panic disorder. Panic attack can be diagnosed by medication and therapies. Medications can reduce symptoms associated with panic attacks. One of the medications is selective serotonin reuptake inhibitors. It is generally safe with low risk of side effect and is usually is recommended as the first choice of medication to treat panic attacks. Therapy that can be used to treat Margaret can be panic control therapy, which is giving exposure to somatic sensations associated with panic attack in safe setting. And the use of coping strategies such as relaxation and deep breathing can be used as one of the therapeutic methods. Cognitive behavioral therapy, which is used to treat agoraphobia, is a systematic exposure to fear situations and is self-guided treatment. The suitable prognosis for her could be going back to the supermarket where the last occurrence happened each day and overcoming the anxiety, whenever anxiety tries to break in. She needs to practice to focus on breathing and keep doing positive talk whenever she feels anxious. And stay tuned on the self-guide recommended by the therapist so that she could move into an action in such situations. However, Margaret is currently doing a great job in her prognosis, as she says that she does positive self-talk whenever the anxiety symptoms arose. She also remembered reading the self-help guide on the internet and using the method to calm her down and telling herself that everything is okay and nobody cares, etc. And since Margaret has been trying to overcome the anxiousness and fear by using her own method, we could note that she is very motivated for her therapy and to change. And she knows that she did a good job and is very proud of herself. Thank you for listening.